Hello and welcome to Med Talks with Dr. Moin. Today in our studio we have Dr. T. Nagendra. Dr. Nagendra is a consultant radiologist at Care Hospitals, Nampally. Sir, welcome to our studio.
Namaste.
Sir, thank you for accepting our invitation. For our viewers to know, sir, you are a consultant radiologist, right?
Yes.
Sir, what is radiology and what do you deal with radiology?
Radiology means, to start with, it is the X-rays which has started. Everybody knows William Röntgen is the one who has discovered.
Okay.
Initially, when it was discovered, nobody know about the medical uses
Okay.
and the radiation, the kind of effects on X-ray which causes on the body.
Okay.
Slowly, as it developed, then we came to know that all the fractures, head injuries, all those can be diagnosed with the help of X-rays. At the same time, the side effect was radiation.
Okay.
So, a lot of protective measures have come.
Okay.
Now, it is with the sophistication of the instruments what we have, we get a very small thin beam where there is a need for X-ray, that part only will be exposed.
Okay.
Rest of the body will not be exposed.
Okay.
Surrounding people will not be exposed. Even if they are exposed, it is very minimal.
Okay.
So, radiation is not a problem
In radiology right now.
Radiology right now.
So basically, radiology means like it is radio diagnostics.
Yes.
By using these radio beams.
Yes.
What all the beams are you have? X-ray.
And gamma radiation,
Gamma radiation.
is also there. But
Okay.
gamma radiation, all those things, now it has gone to radiotherapy
Radiotherapy.
because of the treatments, etc. Radiologist won't deal with
it.
with cancer treatments like gamma radiation. It is only X-rays only deal, which is only medical diagnostic purposes.
So they call X-ray a röntgenogram actually.
Röntgenogram.
Röntgenogram.
Röntgenogram was
Okay.
that. But in India, it is popular as X-ray.
Okay.
X-rays.
X-ray. So you emit X-rays on a person to
Yes.
see what is internally.
Yes.
So what kind of X-rays do you release and what are all the things you can see with the help of an X-ray?
See, X-ray, general perception is wherever there is a bone,
Right.
calcium, metal,
Right.
these are the things which is obstructed by the X-rays are obstructed by, these are the hard things, calcium, X-ray, metals, etc.
Okay.
So, we can see nicely the bones. So, fractures can be seen. But later on, the sophistication has increased.
Right.
So, we got it as a fluoroscopy or image intensifier,
Okay.
where you take some kind of a small drug or contrast material which you ingest.
Right.
Once we do that, you can see how much is the stomach it is filled, how it is traveling into the intestines, how it is going into the large
They
intestine.
call it some barium mill. They give some
Yes,
contrast,
yes.
ask you to take it. Right.
No, it is all inert material, nothing to do with any. When it takes in by mouth, it will comes out after a few
So
hours.
that is not X-ray. It's a fluoroscopy.
Fluoroscopy, but it is based on X-ray only.
Okay.
X-ray only. It has to X-ray radiation will come, fall on the stomach, and all the parts will be seen indirectly.
Okay.
How the intestinal obstruction, how the digestion happens, all those things happens.
Basically, X-ray can detect a material like calcium, for example, bone.
Yes.
In softer tissue and all, X-ray cannot detect. That is why probably you give that contrast material,
Yes.
right? To figure it out what the space or that lining and all.
Yes, it can detect air,
Okay.
and little bit it can detect fat also. But it is mainly basically the calcium is the one, because bones also get calcium and metallic objects.
Okay.
That's the reason why we see when children
They take foreign bodies.
whenever
ingest
they
foreign bodies.
ingest small coins, metallic things, we take X-rays
X-ray.
to see how it is passing. Once it passes, it comes out of the intestines, then we know that it has passed off.
And one more good thing you have said, that it detects air as well.
Yes.
We cannot see air through your naked eye, but as you said, X-ray can detect, right?
One of the commonest X-ray which we do everywhere is chest X-ray.
Just X-ray.
Chest X-ray, apart from the ribs,
Right.
what we see is the lungs. Lungs is completely made of air.
Filled with air.
Air.
So
It is there. And most important thing is, whatever the advanced science has come, chest X-ray cannot be replaced anywhere, especially in the setting of COVID intensive care units. I cannot take a CT scan there.
Right.
Simply mobile X-ray is and this is going to be stand for next 100 years also.
Okay.
It has already stood the standard of time for 100 years.
Okay.
Next 100 years also we cannot replace X-ray.
You mean to say where we are
Yes.
standing today,
Yes.
from the invention of X-rays,
100
it's
years,
almost
more
100
than,
years.
More than 100 years.
You mean to say that
Another
this
100
device
years.
is going to stay for
Yes.
another 100 years?
Yes, it has not replaced.
Right.
That is the value of X-ray, chest X-ray.
We have gone through a difficult times. We have gone through a very bad phase of our life. We have seen the COVID pandemic. And people used to do a lot of CT scans. They used to call HRCTs. Can you just enlighten us?
X-ray for after discovery is almost like 70 years. It is only X-ray, then little bit of fluoroscopy, as I said. After that, not much advanced. Once the advance of electronics, all those things have happened, CT scan has come. That is called computerized tomography. But that is also based on X-ray only.
Okay.
You use a thin beam. Actually in a CT scan also, inside there is a X-ray generator only, which rotates around the body.
Okay.
So 3D body rotates around the body and reconstruction will be done.
Okay.
Because of the advances in the computers.
So it is computer basically.
Computer based with X-ray. So that is the reason why still the CT scan has some radiation.
Okay.
Some radiation. Say for example, if you take a CT abdomen, it amounts to around 300 X-rays.
Okay.
300, 400 X-rays. But we should not think that it is more radiation. Because CT scan, what we get information cannot be replaced by any other investigation.
Even X-ray.
Yes. So when there is a need which is decided by the doctor,
right,
consultant doctor, it has to be done.
It has to be done.
Because, for example, when we are going around,
right,
in the streets, in where we are around here, background radiation will be there, whether you are in a room or outside. That amounts to 3 to 5 X-rays per month.
Okay.
Background radiation.
What do you mean background radiation?
Every day, all the stones, concrete structures, hills, everything produces small amount of radiation.
Oh, is it?
Yes.
Okay.
So you cannot
escape from this radiation.
So some 3 to 5 X-rays per month, that much you will have.
So no matter.
But the problem is, the advantage is you are not exposed continuously. Small amounts.
Right.
So you don't need to feel X-ray is radiation kind of thing. The uses far more outweighs the losses. There is no proven loss of life or damage to the body till now. How much we give radiation for CT scan, X-rays, till now there is no proof that it causes harmfulness to the body.
No matter it produces some amount of radiation, but as sir has said that they are getting exposed for a very limited, minimal period of time.
Yes.
So that you need not worry about it. If somebody writes you a X-ray or a CT scan, probably you may go for it. But there is a condition, sir. You call it somebody is pregnant.
Yes.
Sir, what are the contraindications like for people who are pregnant?
See, pregnancy is also it is a type of where the cells are producing within the mother's womb.
Right.
So this fastly producing cells are radiosensitive.
Right.
So you get some radiation. If they get, there is said to be harmful effects, not yet proven.
Okay.
But since medical fraternity is very conscious of these things, so we try to avoid first 4 weeks.
Okay.
First 4 weeks is the time where organogenesis will happen. All organs in the fetus will be forming.
Okay.
So, first 4 weeks we try to avoid. Still, if there is a problem, like patient with COVID, mother's life is more important.
More important than.
So, we tend to take some X-rays. Again, it depends upon the doctor who decides. So, if he feels that the X-ray is outweighs the advantage or the disadvantage, it can be done.
It can be done.
It can
but
be
certainly you will use some radioprotective
lead protection
envelopes across the body, across the abdomen, or probably then you go for it. But sir, as you said, you are talking about X-ray radiation in pregnancy. You mean to say that these X-rays, these beams which are going to pass, are going to work on those cells which are like in the reproductive phase?
Yes, it can. It will affect, but the problem is actually the public has to understand that the amount of radiation which we give for X-rays and CT scans is not going to
Harm.
harm. But still, we try to avoid as far as possible. That is called ALARA principle. As far as possible, we try to avoid. But still, it is not proven.
Okay.
Not yet proven at all.
At the cost of saving biggest
Life.
thing, what
Life.
you call is life and early diagnosis.
Yes.
To coming to know the secrets which are inside, probably we may have to take this challenge, which is not going to be directly or immediately or that hazardous, but with precautions and all, we may go for the investigation. Sir, there is another module which are people talking about. They call it MRI, magnetic resonance imaging. So can you just brief us about that investigation?
Magnetic resonance imaging is about the causing the magnetization of the body.
Okay.
Already we have, it uses the hydrogen ions.
Okay.
And one of the commonest ion present in our body is hydrogen, H2O.
Okay.
So hydrogen ion is there. So with the help of big magnet, what our body is made up of small magnets.
Right.
We try to get the imaging, soft tissues. But important thing is, it doesn't have any radiation.
Okay. When compared to X-ray and CT
No
scan?
radiation is involved. That is the reason why when pregnant lady comes, we do ultrasound.
Okay.
Ultrasound is, there is no radiation, only sound waves.
Okay.
If there is still we think that there is a problem, still further evaluation for the fetus, we go for MRI.
MRI rather than going for this X-ray and CT scan.
Yes. Ultrasound, then MRI.
Should we say less harmful or no harmful at all?
No harmful at all, no proven at all. But still, as a medical faculty, we take some precautions.
Okay.
So we try to avoid for first 4 weeks. Even for MRI, MRI is there for last 30 years.
Right.
Not a single case of congenital abnormalities or harmfulness have been proven.
Post MRI.
Yes, post MRI not proven. But still we take precautions. As far as possible, we try to avoid. Still, if it is needed, if the life of the mother is precious, when we want to save, sometimes we take. Say for example, fits, seizures have come. Any problem in the brain and spine, MRI is the best.
Okay.
That cannot be replaced by any other modality.
That is a gold standard?
Yes, gold standard. Okay. So sometimes patient can have stroke or something suspected stroke. We have to do
an MRI.
When patient is pregnant, still we can do.
Sir, there is another tool, we call it ultrasound. Sir, what is ultrasound? Is it again a radiological tool, or is that got some other
uses? Yes,
technique?
Both. Now the technology is wide variation so much that ultrasound can be used by, it is not owned by radiology or some other specialty.
Okay.
It is a tool where it can be used wherever it is useful.
Right.
By respective specialists in their own area.
Right.
It is initially started by radiologists who have started using. Now other people also, they use it. Because the technology is advancing so fast. Previously we used to handheld probe, we used to have ultrasound. Now like endoscopes.
Okay.
So we can send it into the body.
Okay.
So gastroenterologist can use it.
Okay.
Surgeon can use it.
Okay.
The same thing, it can be used into the blood vessel. So vascular surgeon can use it.
They call it IVUS, intravascular ultrasound nowadays.
Yes.
It's a recent advancement, right?
Recent means 10 years back it is there. Ultrasound is nothing but sound waves which our audible range is 20,000 to 20 hertz to 20,000 hertz.
Okay.
This is beyond.
Okay.
So we cannot hear it. But the basic principle is, when you direct it to the body, it hits the body parts and comes back.
Okay.
So the difference in densities and absorption, that is taken by calculated by the computer, and it comes as an image. Okay. And again, there is no radiation.
So you mean to say that in pregnant women, ultrasound is safe?
Yes, that is the only modality that is available.
Okay.
If that is not there, then next is MRI. So all screening has to be done. To start with, it is.
Sir, anybody who becomes pregnant, majority of our women folk, they go for a gynae checkup, and our gynecologist, whenever required, they ask for an ultrasound.
Yes.
Is there any limit that should not go for ultrasound, or they can get
limited number of? No, there is no need. Because
Nothing like
there is
that.
no radiation involved.
Okay.
It can be done as many times as possible.
Okay.
Sometimes gynecologists call the ultrasound as their extended hand.
Extended hand. Okay.
It went to that. There is no gynecological investigation without ultrasound. That's what they say
Okay.
nowadays.
Sir, and for pregnant women, like in the first term, if they are suspecting any problems and all,
Yes.
they do a scan called TIFA scan, right?
Yes.
Is it again ultrasound or it's another modality?
See, it is basically done around 16 weeks, 16 to 18 weeks.
Okay.
The reason is, by that time, as I told you, organs have
Been formed.
already formed. But it should be in a ideal size so that I can see all the parts. If the patient comes at last weeks, 36 weeks, 38 weeks, all body parts I will not be seen because it is cramped.
Right.
But 16 to 18 weeks, 20 weeks, all the body parts will be freely floating within the amniotic fluid. So that is the time where we try to see all the parts, or system by system. CNS we first see, spine we see, heart 4 chambers, pulmonary artery, aorta, flow, hepatic veins. So system wise we will be able to see even 4 limbs, whether each limb has
Right.
tibia, 2 bones,
Right.
radius ulna,
ulna.
then 5 fingers.
Right.
All those things we will be able to see
In TIFA.
in TIFA. So it is targeted ultrasound. That is targeted to each system. So we can see in detail.
Okay.
So that in that time of pregnancy, we will be able to see. That's why we call it targeted ultrasound. We take more time to do it, around 35 to 45 minutes, sometimes 1 hour.
Okay.
It takes.
Okay. Because you have to check each and every part of that
most
body.
of the parts. Still, there are some soft parts which we can miss. It is not 100%, but I would say it is 80 to 90%.
Okay.
It is not 100%. It is not like that.
But still, sir, it's an amazing thing. We do an ultrasound to know how is our gallbladder, how is our liver,
Yes.
and how are our other parts in our abdomen. But you are doing this ultrasound to see what's there in the mother's womb. And you are just looking at the fetus and you are checking the heart and the 4 chambers of the heart. It must be an amazing tool.
Yes, it is amazing tool. Now, see, for example, if there is a doubt, if there is heart problem is there, I can also see. At the same time, cardiologist also, they are also specializing.
Okay.
Ultrasound is more or less, with a little bit of software change, it is called echo.
2D echo, they
2D
call it,
echo.
right?
There the frame rate is slightly higher because heart is continuously
So you mean to say ultrasound and 2D echo, these two are one and the same?
one and the same.
They work on the same principle?
Yes, same principle, little bit of software, it is difference, that's it.
Okay.
I can use the same mission, he can also use my mission.
Okay. So there is some difference in the device.
Some software devices, calculations, because as I said, no, heart will be moving fast, 60, 100, no. Okay. So you want to check walls, you have to have little more of some other gadgets kind of thing. So it can be done.
Oh.
So it is more or less same.
Okay. Yeah, amazing to hear about the technologies
Now,
in radio diagnostics nowadays. Sir, is there anything else we have in this trending world?
Yes, now gastroenterologists are started using, they have endoscopes.
Right.
Now they have endoscope fitted with ultrasound.
Okay.
So deeper parts within the stomach, wall of the stomach.
Okay.
They can see, if they want, they can do a biopsy.
Okay.
They can go to biliary ducts.
Okay.
They can do a brushings. They can take a biopsy. All those endoscopic ultrasounds have come.
Okay, endoscopic ultrasound.
And you, as you said, intravascular also.
Right.
Vascular, you use it for coronaries to break the blocks, all those things. In the same way, lower limbs, aorta also we can.
Any vessel can be reached.
Yeah, reach. So there we can use that intravascular ultrasounds. Okay. The principle is the same, but the uses have, over a period of 30 to 40 years, it has increased.
Wide range of usage is there.
Yes.
Where you can use these tools to find out about the well-being of a human being. So we have come to a point where everything is accessible, provided that you meet the right physician, the right radiologist.
Right indication, whether it is needed or not, that is very important.
Exactly. And the physician has to decide what is indicated and what is contraindicated.
And we should not have over usage of this kind of.
Right. Right.
This board becomes costly, as well as little bit radiation, all those things are there.
Okay.
Each service costs, nowadays the cost is the one which is making, but the problem is we think cost, but these instruments are not cheap.
Right.
It took 30 to 40 years, 50 years for research. For example, a good MRI costs around 8 to 10 crores.
Okay.
And maintenance cost,
Mm-hmm.
just services, that costs around 8 to 10% of the cost of the mission
Annually?
annually. That means you
Wow.
have to have 60-70 lakhs for a 10 crore mission. You have to have 70 lakhs for maintenance per year.
Okay.
It is not that easy,
Mm-hmm.
because these are all highly sophisticated missions. They need regular servicing.
Yeah, no doubt about it. The scientists have given their whole time, inventing all these devices, gadgets,
Generations
and
together, yes.
generations together, as you said. And they cost us a lot. But no matter what the cost is, in our country,
Human life.
those things are available across the country. And I should say they don't cost us a lot, like they cost in the other parts of the world, and they cost us not very much.
Yes,
They
that
are
is-
not very expensive, I just wanted to say. One, and second thing is they are accessible now
Accessible now.
on each and every part of the city. Like even in smaller towns, we have radio diagnostic centers which are well equipped with ultrasound, CT scan, and even MRI.
Yes.
Sir, I have been listening to a newer term nowadays, interventional radiology.
Okay.
So what is interventional radiology?
Radiology means initially what we are doing is diagnosing.
Right.
X-ray, we diagnose infection, tumor, something. Ultrasound, then pregnancy, you said some diagnosis, normal pregnancy or abnormal pregnancy, CT, MRI, from strokes, all those things. So this is one spectrum. Now there are other things have come up. For example, if there is a tumor in the, or some say pus in the liver, previously how they used to do, they have to cut open the abdomen, see, then cut organ and remove the pus. Now there is no need.
Okay.
I will see the ultrasound, there is a pus is there, immediately I will put a needle inside and aspirate. Simple OP procedure, outpatient procedure. So there is no need for opening the stomach at all. It is an outpatient. That means he comes after 1 hour after the procedure, he will go home. You get the pus, you can do the further analysis,
and,
culture,
microbiological
and
studies.
antibiotics you can be given, and pus totally can be removed.
Okay.
If still more pus is there, I can put a tube.
Under guidance to
Under
do that.
guidance, I will put a tube which is attached to the bag, so that for a week or so he will be attached to that tube, so that how much pus is coming, slowly it comes. If thick pus is there, it will take several days to come out. Again, surgery is not needed. It is outpatient procedure. These are the things called interventional radiology. I am intervening.
Okay.
That is, I am treating.
Like you do an FNAC,
Yes.
you do a
Biopsy. The same thing, ultrasound, CT scan also we can do. Lot of CT scans where there is inaccessible parts, deeper parts,
Right.
with long needles, all those things. Especially it is very important for cancer therapy. Cancer will be spreading somewhere.
Right.
Whether that is a cancer spot or not, we don't know. A CT scan shows some abnormality, but for a cancer thing, you have to prove that this part is, this particular thing is.
So you need to take a small piece from there
Yes.
and send it for cytology.
Yes. So biopsy, that is one part of it. The other part is vascular.
Okay.
For example, as you know, cardiologists do coronaries, they put a stent,
Okay.
so that flow will improve.
Right.
In the same way, in the limbs,
Right.
if there is narrowing, radiologist go there, put a stent or dilatation and do improve the flow.
Right.
In the same way, some of the tumors in anywhere in the body with highly vascular. So first, radiologist will go there and block the blood vessels supplying it temporarily. So that will be hold it for next 1 week. Within that time, surgeons like you can do the surgery and remove it with minimum amount of
Yeah,
bleeding.
in tumors like we come across angiofibromas and
Yes.
all. We take radiologist help to stop the blood supply across the tissue
And clean surgery
or the
completely
across the
can be
tumor,
removed.
right?
Completely
So
can.
even that is being done by
Yes.
you guys.
And there is in the brain whole set of new interventions are there, where the strokes comes, aneurysms. So they can put a stent, they can put a coiling, and they block it. The cath lab. Cath lab is again
Again, X-ray, right?
X-ray. It is driven by
continuous,
X-ray.
right? It is continuous emission of X-rays.
It is again X-ray. Some radiation is involved. but is very sophisticated technique where you can do angios, blood vessels, all those things on this kind of procedures also
And
can be done.
probably you expose a limited part of the body, right?
Yes. Rest of the only limited thin beams. Sophistication is more now.
Okay.
Where there is that much thin beam is, the rest of the part is not exposed at all.
Okay.
But still we cover it with lead sheets so that rest of the body is not exposed.
Radio diagnostics, starting from X-ray, deals with X-ray, ultrasound, then CT scan, then MRI, and in interventional radiology, they are capable of using the newer gadgets, stopping the what you call blood supply to the organ where they want to remove. Sir, apart from that, nowadays, apart from these X-rays and all, you spoke about gamma rays. So, do you deal with gamma rays as
No,
well?
gamma rays we are not dealing. See, say for example, 60s, 1960s, 50s, where not much of medical facilities were not there in India. There used to be only X-rays were there, not even ultrasound was there. So, these X-ray missions, some more X-ray radiation where it can produce much more intense X-rays, they were using for treating the cancers.
Okay.
So, at that time the whole thing was under radiology and radiotherapy.
Okay.
Now with the sophistication of missions, they stopped doing a radiation for tumors with X-rays. X-rays now they have separated for only diagnostic
purpose.
because more useful, more sophisticated, more authentic radiation, gamma radiation is there, where that is useful for treating
Therapeutic, right?
the cancers.
For example, like gamma knife we use in surgeries, cyber knife.
All those things.
All these things probably are done for the therapeutic.
And the specialty is separated. That is as radiotherapy.
Radiotherapy.
The treatment part of the cancers they take care. Okay. So it is completely different. We don't use gamma radiation at all.
Okay.
Then there is a nuclear medicine which they use it for diagnostic also little bit of. Okay. Radiology doesn't come under those things.
Sir, you as a radiologist, you are continuously working in that department. What are all the challenges you come across being exposed to the radiation and being close to the modules, X-ray, MRI, and what you call the other stuff?
It is fascinating. As far as I am concerned, last 20-30 years, this is the last 30-40 years is the one where the advancement of radiology has happened as never before. For example, CT scan itself. Previously, when I was there in 2097, it was single X-ray. That means, if you want to take one CT scan brain, it will take 10 minutes.
Okay.
Patient has to lie down without moving. One X-ray, then stop, then one more radiation, then one more exposure. Like that, 20 exposures we used to do. Then CT brain will come in one way. Now, that is not the question. With the multi-slice CTs, it will take 3 to 5 seconds per CT brain.
Okay.
Before patient think about moving, brain CT scan is over.
The imaging is done.
And that too, it is 3-dimensional.
3-dimensional.
Previously, it is like 2-dimensional. One slice, one slice, one slice. Now we don't take
360 degrees.
We take a volume. Volume of data is taken. So you can put it as axial, sagittal, coronal, oblique, anyway. You have a volume data.
Right.
In whichever way you want, you can reconstruct. Okay. That is very, very useful for surgeons.
Right.
How to approach a tumor. It is same thing for abdomen CT also. I know that most of the surgeons, they do the surgery. Before going to surgery, they come to radiology, discuss the approach, then directly they go to operation theatre. That much is the usefulness after this multi-slice CTs.
Yeah, it is obviously thanks to the technology and people who have invented those. And the recent advancement is computer, with which you people do the reconstruction and the 360 degrees evaluation of that.
The pressure on the radiologist has increased over a period of time. We have seen, because when I was working with single slice CT, this much one abdomen means 30 to 40 slices.
Right.
Now it is almost 900 slices I have to go through.
Oh my God! You have to study section to section.
Section I have to see, and how much is expectation from the radiologist has increased several times.
Right.
Because the resolution is increasing, so surgeon or physician needs more information.
Okay.
He want more information to treat the patient.
Okay.
That kind of pressure has increased so much.
Okay.
It is surprising.
Okay.
I was seeing 30 to 40 X-ray, 40 images. Now without computer I cannot see because it is 800 to 900 X-rays. That
Right.
too reconstructions.
Hmm.
We have to do manually on a real-time basis. We have to see. So that pressures,
Yeah, I understand
expectations
it
has
must be
increased.
very challenging
Yes.
and at the same time big pressure on you people.
Yes, yes.
So I understand. But no matter what you all do, it is going to benefit the human kind, and people are
suffering.
going to benefit.
Suffering.
So advise that people should uh, avail all these
Yes.
technology opportunities.
And don't get
available
biased
over
by
you.
the radiation. Radiation is very minimal. There is no proven things.
Okay.
This 30, 40 years or 50 years of research has accumulated. There is no radiation in
Other than
abnormalities.
pregnancy,
That is also precautionary.
precautionary.
Yes.
You need not go for it.
You did not worry about it.
You need not worry about it. Sir, one question I have for you. In our country, there is one special act which government has, incapitated, where you call fetal sex determination.
PNDT Act. That is
PNDT Act.
PNDT Act.
So this fetal sex determination is an illegal thing in our country.
Yes, it is.
Why is it, and how can we avoid that?
See, in any society, male-female ratio.
Right.
Females are more and males are less.
Okay.
That is natural things.
Okay.
When this changes, then lot of exploitation as a society also can happen.
Okay.
And because of the social problems, all those things, infanticide, killing the female child has happened rampant. Not only in India, it is not in India also. It is all in Asian countries.
Is it there in other
China
countries?
also it is.
No,
everybody wants a male child.
No, I mean to ask you one question. Is this ban only in India or
Yes.
in other countries as well?
No, other countries it is not there. In various forms it is there. In various forms it is not. In West it is not there because it is having a girl child is not a taboo.
Taboo.
But in Asian countries it is there. So government has come with a very powerful act where they can arrest a doctor if they think that the doctor has done a mistake under this. That means basically
Violated the norms or
that
violated
means
the
he should not disclose
the sex of the fetus.
fetus to the family members.
And how do you do that, sir? When you are doing the test and all, you don't do that part, or you don't disclose it, or how do you?
We have to see sometimes
Right.
those organs we have to see, and then
So as to find out if there is any anomaly or not, you
have to see.
Right.
So in that way, government has avoided. We should not reveal that.
So at the same time, you have to do the screening,
Yes.
fetal screening,
Yes.
and
Yes.
you have to check whether all the vital organs are safe or not. But government has come up with a beautiful
It is not only
act
come
where-
up with not only for doctor, but even the patient also. They have to sign some forms
Okay.
that I have not asked for fetal sex.
Fetal sex.
It is not only by the doctor, even by the mother and the husband. They also have to sign it.
Oh, they have to sign a form before they go for an ultrasound.
Yes.
Oh,
And they have to give their address, Aadhaar number,
Okay.
everything is there. Government can come back to them.
Okay.
So that much rules, regulations are there. Each patient I have to fill, and at the end of the month I have to submit to the government.
Okay. It is under the supervision of a collector, magistrate.
Yes,
right?
yes. Strictly, all over India it is the same. It's strictly followed.
Thanks to the strict laws of the government, so we all are under big radar, and the number of these atrocities have come down.
Yeah, significantly has come down. Still it can happen in a country like India, but it has come down to the larger extent.
Nevertheless, we should just consider all these things which have evolved over a period of time, the so-called technology. We should take the positive side of it and use it in the right manner,
Yes.
so that we can use it for the benefit of the mankind.
Something like a double-edged sword.
Exactly. Sir, thank you so much for spending your valuable time with us and talking to our viewers.
Yes.
And I hope that this information is going to be helpful to you in many ways. Please use it in the right way, and please share it among your loved ones, your friends. Thank you for watching us.
Thank you.
Sir, thank you so much for your valuable time. Welcome to Med Talks with Dr. Moin.